Health departments are warning people to be on alert for measles as concerns grow about a rise in cases in Australia. To tell us more, Professor of Global Biosecurity at the University of New South Wales, Raina McIntyre, joins us now. Raina, good morning. Just take us through where exactly we're seeing measles outbreaks in Australia at the moment and how did it reach those areas?
So we've seen 33 cases so far this year in Australia, mostly imported through travel, but in Melbourne there were cases that were transmitted within Melbourne without any international travel. The latest the latest concern in New South Wales is someone who returned from Vietnam with measles, and there's potentially people exposed on the flight at the airport and then in a number of health services, and that person went to Western New South Wales. The issue is we've had a falling rate of vaccination. Our childhood vaccination rates have dropped from about 94% to 91%, and that's part of a sort of worldwide trend we've seen after the COVID pandemic of increasing vaccine hesitancy. So it is a real problem because it makes us vulnerable to these outbreaks.
How concerning is measles as a disease? What sort of effect does it have on your body and who's most at risk?
Measles is a really serious infection. It can cause a very unpleasant febrile illness with a rash that lasts about 2 weeks, but it can also cause pneumonia and a kind of brain infection called encephalitis, which can be fatal. And in a very small percentage of people, the virus mutates inside the brain and then causes a fatal encephalitis or brain infection some years later. So it really is a deadly virus, and we've had it well controlled in Australia in the past. So we need to make sure it doesn't get a foothold in Australia again.
How is it spread and how can people best protect themselves from measles?
So it's an airborne virus. So if someone's got it and you're sharing the air in a room or a space with them, you're at risk if you haven't been vaccinated or if you're non-immune. The biggest risk groups are children under the age of 12 months who haven't yet had their first vaccination dose. And young adults tend to be under vaccinated, and they're often the ones who travel overseas, pick it up overseas, and bring it back into Australia. And if you are not sure of your vaccination status, talk to your doctor. And the Australian guidelines say you can have a dose of vaccine whether or not you know what your vaccination status is. And it's especially important if you're planning to travel overseas because there's measles epidemics everywhere, not just in Asia, but in Europe, in America, in a whole lot of different countries. So look at what travel vaccinations you should get, including potentially measles.
All right, Professor of Global Biosecurity at the University of New South Wales, Raina McIntyre there. Thank you so much for your time.
Thank you.